everyone. Thank you for joining us for episode 6 of PCOA Voices. I'm your host, Lisa Reeves. From about 8 to 5 every day, this space serves as my office as the Vice President for Programs and Services at Pima Council on Aging. And the rest of the week, it's just my living room. Now, the purpose of PCOA Voices is to bring Pima Council on Aging into your living room, no matter the time of day. We want you to get to know us better, explore issues that impact older adults in our community, and show you how PCOA, as your local nonprofit area agency on aging, can help you with those issues. If you're just now tuning into this series, we're glad to have you. You can catch up on any prior episodes of PCOA Voices that you missed, either on our website, which is pcoa.org, or on our Facebook page. And if you're watching our broadcast live on Vimeo or on Facebook Live, you can interact with us via chat. We have staff here to help you, and they'd love to just be able to say hi. All you would do is just type your comment or your question into the chat screen and just push enter. So as we get older, all of us are eventually going to start needing some help around the house. And this may be helping us bathe, clean the house, cut our nails, change our sheets, or even administer some basic nursing care. And some people may have friends and family that can provide needed assistance for a while. Sometimes professional help in the home is also needed. And sometimes people need to consider facilities for either short-term care, like rehab after a hospital stay, or for long-term living arrangements. But in order for any of these personal care situations to work, we need to have enough dedicated, well-trained workers. And as the number of older adults in this community, and across the country, frankly, continues to grow, the number of home care workers just hasn't kept up with it. There are many diverse reasons for this, and Pima Council on Aging's family of companies is working to address this workforce shortage to make sure that all of us have the well-trained professional caregivers that are available when we need them. Well, how are we doing this, you may ask? Well, let's meet some experts. So to help us understand this issue, I've invited 3 staff from Pima Council on Aging's family of agencies. You've met Rebecca McGee and Yadira Mosqueda on the show previously. And joining them today, please welcome Larissa Kalashevsky.
Thank you.
So let's start with you, Rebecca. You oversee all of these professional training and home care programs at PCOA. Let's start with some of the basics. Why is developing a reliable, capable workforce of frontline healthcare workers important to PCOA as the local area agency on aging? And what kind of workers and jobs are we talking about?
Sure. So we know that not everyone has someone to care for them, a family member or a friend who's close by. And it's really important for people to age in place. We know after talking to a number of folks in our community that that's one of their main concerns. And according to the US Census Bureau, by 2060, the number of older adults, 65 and older, will double to 95 million. And as a result, the need for home care is predicted to increase dramatically, needing over 1 million more jobs by 2026. And while the direct care workforce specifically has doubled in the past decade, we certainly have a lot more work to do in order to meet that need. We know that there's a growing need across entry-level jobs in healthcare. So through our programs at PCOA, Pima Care at Home, and the Caregiver Training Institute, we're able to provide training for folks to become direct care workers who provide non-medical in-home care so that folks can remain safely in their home, as well as training certified caregivers and nurses assistants who provide care for a number of older adults and others in our community in places like hospitals, surgical centers, rehabilitation and long-term care facilities. In addition to that, we also offer assisted living manager training for folks that really want to continue advancing their career in that way in serving folks in the healthcare industry.
Well, thanks for helping put all that in context for us, Rebecca. That's really important work. And I can see that that's definitely something that falls into the realm of what PCOA as the local area agency on aging would want to help address. Yadira, you're the director of PCOA's home care company, Pima Care at Home. Tell us how you train and support the direct care workers that go into people's homes to provide care.
So we have always really emphasized the importance of training direct care workers so that they have the tools they need to go into the home and provide adequate, amazing care. So we do a training that's required by the state. It's a 3-day training that we provide. And one of the things that we really wanted to look at is how do we provide caregivers with not just, the didactic portion of it and the book portion of it, but an actual hands-on training where they really understand what working in a home really looks like. So we were fortunate enough to be able to create this studio-like training center for caregivers that we opened up last November. And we used for a very short period of time because of the pandemic we're living in. However, it is an amazing center where we have all the durable medical equipment that most folks see in people's homes. Caregivers were able to come in and during the training that they received, the whole third day is dedicated to just the durable medical equipment. And just ensure that they understand how to utilize it and whatnot to ensure that they receive their certification. And after the training is over, that is required within the first 90 days of employment, we continue to provide that support for them, which is really, really crucially important for them. That piece is what really ensures that they do understand what their role is in the home. We have a person that is dedicated to provide that caregiver support. She is available to, well, back then was available to go into the home and really do the hands-on training in the client's home. And also we have a 24-hour support line for our caregivers, as well as the continuing education that we offer annually. With all this pandemic and COVID-19, we were able to continue providing training without any interruptions. Obviously, it was via virtual platform. But it's very important that we know that people are looking for employment, and a lot of people were looking to outreach how to help the community and those vulnerable adults in our community. So we've been able to continue hiring employees and been able to continue training them, which is really, really important, that we're not just sending caregivers into homes not knowing what they are really doing. And even though it hasn't been in person, we were able to utilize, our platforms to provide and do the demonstrations in office for them to, if they're in the client's home, we're able to contact them via a telephone, and we can show them how to use a machine by utilizing it in the building. So that has been very interesting. It's a different experience. However, the material is still being taught and the caregivers are still getting trained just a little differently, but it's been vitally important. And I think I myself, when I first started in this industry in healthcare, I think that's where I felt that I had a lack of information, because even though I read the books, I passed my testing, when I actually, I was working in a hospital setting, when I really got to the hospital and I was like, oh my goodness, this is totally not what the book, told me. I just really want to ensure that our caregivers know from day one what they're really walking into, and providing them that information, the tools, the resource, everything they need. We're setting them up for success, is what I believe.
Thank you for sharing that personal story. I think that really helps understand why that's important to you. And the Caregiver Skills Lab, the training lab that you talked about, our viewers on PCOA Voices have seen that a few times already now.
Yeah.
See you demonstrate some of the equipment and tools that they could use. So thank you for all the adapting that you and your team have been doing over the last few months. It's really been fun to watch. Next, let me go to Larissa. Larissa, welcome back.
Thank you.
You worked previously at PCOA in a different role and has recently joined us again when the Caregiver Training Institute became a part of PCOA's family. Larissa, tell us what programs the Caregiver Training Institute provides and how those are structured.
Sure, absolutely. So we have 3 main programs. We have a caregiving program, nursing assistant, and the assisted living manager program. They're all structured, well, right now, again, with everything happening due to COVID, we've kind of created a mix of virtual learning and hands-on learning in our classrooms. So for our caregiver class, for example, traditionally you would have all of that didactic in person on campus, and then later in the day you go ahead and get into our skills lab where you're learning how to change, bedding, move people safely. So right now we are doing all of the learning online and then doing all of our in-person skills on campus. And the nursing assistant is very similar to that. You're going to have skills as well as clinical experience. And right now, traditionally, that's been in an actual clinical setting in the community. And we're working with community partners and the Arizona Board of Nursing to make sure that we're doing that as well as possible to get these folks through their programs. But basically a mix of really getting it in there and then getting those hands to work and to really feel what they're going to be doing. So there's a lot going on. And again, right now we're just making it work as we can with this new online world.
Right. Well, I love that we have your energy back here supporting our new home health workforce. So thank you for that. I can tell you really enjoy what you do. You were recently telling me about how meaningful this work is for you personally. Would you be willing to share that story with our viewers?
Absolutely. So this is so meaningful to many in our community and me personally because my mother needed care, and she had been diagnosed with cancer and has since passed. But during the time that she was going through treatment and times when she just needed a little bit of extra care, we did have caregivers come into the home. And these folks were doing things that maybe weren't even something that was super perhaps medical, but so important to her. She needed to clean out a drawer or she needed to organize something and she didn't have the energy to do it. And they were there to help. And it made the biggest difference for her. It gave her back a lot of her independence when a lot of that had gone away. So this is very important work, no matter what setting it's being done in.
Thank you for sharing that, Larissa. I'm sure that experience really helped you understand the needs of people receiving care a lot better. Rebecca, you also shared recently with me how personally fulfilling this work is for you. What in particular do you find fulfilling about it? What attracted you to this work?
Sure. So I really believe that our ability to have older adults in our community receive excellent care, whether they are in a facility or in their own home, starts with us taking care of the caregivers themselves. For me, it's really meaningful that we have an opportunity to provide caregivers in entry-level positions, especially the critical tools that they need in order to be successful in their jobs, whether that's training, whether initial training or ongoing training, and understanding that this job is very emotionally and physically taxing. They're the heroes in our community that are often unseen and unrecognized. So it's really about recognizing the amazing work that they're doing, going in and taking care of the most vulnerable people, and oftentimes our family members that we can't take care of. So for me, it's really about giving them the tools they need and the support they need ongoing to do this really challenging, difficult work.
I agree with you that the home care workers across this community are definitely heroes for all of us, especially now. And Yadira, if somebody's seeking in-home help to care for either themselves or one of their loved ones, help us understand what they should look for when selecting a home care company.
So I think it's very important that you don't always just pick up the first agency you find across the yellow pages or online on Facebook or social media for that matter. I think it's very important that when you are looking for an in-home care agency, that whether it's for yourself or for a loved one, that you talk to a few agencies, you ask questions. Everybody has a care plan that's unique to themselves. We want to ensure that people, some of the questions that can come up is, what kind of screening do their caregivers undergo? What type of training do they receive? Are they certified caregivers? It's just very important that you just don't go with the first agency, although that might work and it's, you know, it's always like a 50-50. Look around, call around. You know, it's vitally important. There's obviously Pima Care at Home is always available. If you have any questions, you know, we offer free in-home quotes. So if you're not sure if you really need the care, but you're kind of thinking, you know, you might have some type of appointment that you need accompaniment to, or you might be having a procedure in the next couple of months and you're just shopping around, you know, give us a call. And there's other great agencies that if we're not the fit for you because of, you know, the area that you're serving, or, you know, we don't have a caregiver in their area, because that can also be an issue that a lot of folks who are seeking an in-home care agency is that they live in a hard to serve area. So ensuring that when you are speaking to your agency that they will have a backup caregiver in the event that the caregiver becomes ill, that is vitally important that they do ask that, because you know, you need to have some type of contingency plan in the event that, you know, your agency might not have anybody because you live in Oro Valley or Corona de Tucson, or, you know, out in the middle of nowhere. Yeah, you have any questions, you can always give us a call. I know a lot of agencies also do, you know, free in-home quotes. Well, now online quotes or over the phone quotes. But yeah, always ask questions when in doubt.
That's great information.
Yeah. Or look on our website at PCOA as well.
I was just going to say, the PCOA website is such a huge resource, and if you're just looking for almost anything you can think of for the older adult in your life, for yourself, if you're just curious, there is a huge resource available. Just PCOA.org, wander around. It's fantastic.
And if you're
the
somebody
part about finding the best fit for you is really important. That's what asking questions, regardless of the service, will help with.
You might just find that, you know, sometimes the relationship that you have with that person on the phone, it just something clicks, and it really might just be that conversation that you have that you just might have a hunch and feel more comfortable with them. So it's really not being afraid to call and ask questions. That's what it's about. We want to ensure that the person that is receiving the services completely understands what their care plan will look like, what their contingency plan will look like, and what they're really, with Pima Care at Home, we really try to focus, okay, so we're not just going into your home to provide that care. What goals do you have in the home? What is the purpose for us going into not just providing personal care or meal preparation, but we kind of like to push people a little bit more and see what their desired goal at the end, you know, towards the end of their services. So, you know, Pima Care at Home, you support the work of PCOA, but like we've already stated, there's many other agencies that are great out there, and we'll be glad to assist with any other questions they might have.
That's awesome. Thank you. And if anyone has questions, you can always call PCOA's helpline at 790-7262, and our helpline specialist can help you either get a list of all the agencies that you could talk with, or give you some questions that you could ask, or just kind of think through that with you. Larissa, let me jump back up to you for a minute. If someone's interested in exploring or learning more about training at the Caregiver Training Institute, how can they learn more about the training programs you offer?
Sure. So the best way to start out is to go to our website at cgtiaz.org, and that will give you all the information about different classes as well as our contact information. Our phone number as well is 325, hold on, I got to learn it, 4870. So 325-4870. I'm still getting there. I'm a little new. But those are two wonderful resources. And if we don't answer right away, please do leave a message. We are here. We're just working really hard to make sure that everything is in place and safe and ready to go for you to learn.
Great. And I believe we have some graphics up on the screen to help you all see those websites and phone numbers. Well, thank you all so much for taking the time out of your day to share those resources with us and explain to us the importance of a caregiver workforce and how we can access information when we need it. And thanks for being a part of PCOA Voices.
Yes, thank you so much.
So next up, backed by popular demand, Here is Marty with your health, aging, and wellness tip of the week.
Hey, Marty.
Hi, my name is Marty, and I'm here with a little healthy idea for you. Today's healthy idea is a get up. That would be when you are getting up from the floor. Now, you might find yourself on the floor sometimes accidentally. That's never a good thing. But other times you might just be doing something that requires you to be on the floor. And, it's a good idea to practice getting up from the floor, regardless of whether you plan to be there or not. But the first thing I want to tell you is if you do find yourself on the floor and it wasn't planned, stay there for a couple of good minutes, breathing, calming. Don't be in a rush to get up. Just take a minute and kind of do a little body scan. See if you hurt anything. And then you could do this get up. So let's all go to the ground. And the first thing about a get up that I'm going to suggest is that you bend your knees in and roll to the side. You then push yourself up, and we're headed for furniture, which we might have to go to the hands and knees position, or what's called table, and move toward the furniture. My chair is pretty close here, so I don't have to move too far. But then what I'm going to suggest is that you step a foot forward, and the hardest way to get up is to go straight up. So instead of going straight up, I'd like you to try and just push yourself forward. And then you've got a chair right here. You can just come back and seat yourself, or, move all the way up then to standing. And this is a great workout. You might even consider setting your timer, for 3 minutes, 4 minutes, something like that, and practice getting up and going back down and getting up and going back down. It's a good workout. So if you'd like to do it again real quick, we'll just head back down. Again, roll to one side, push yourself to seated, crawl or move to furniture, put a foot forward, whoosh yourself up, and have a nice, safe rest of your day.
Well, it was great to see your smiling face again, Marty. It's such a helpful demonstration, and I'm going to practice getting up with my mom very soon. Even at my age, that's a good technique to learn. So one of the roles of an area agency on aging, as you heard on our previous episode of Voices, and even a little in our last segment, is to advocate for the needs and issues of older adults. And PCOA employs a staff member to do just that. I would like to introduce you to Maddie Bynes.
Hi, Lisa. Thanks for having me.
Great to have you here, Maddie. Tell us a little bit about your role at PCOA.
I'm the Public Policy and Advocacy Coordinator. So what I do is essentially government relations for our local, state, and federal officials. I also am the statewide coordinator for the Arizona Association of Area Agencies on Aging. I do a lot of communications work, special contract work, and one of the big things that I do, and the reason I'm here today, is to talk about ageism and how it affects older adults and people of all ages.
That's awesome. I know we're so lucky to have you in that role for PCOA, Maddie. Well, tell us more about what you mean by ageism. Can you give us a couple of examples?
Yeah, so ageism is the discrimination of a person based on somebody's age. And like all the other isms, there's a lot that goes into it. One example could be if an older adult goes to the hospital and says, my knee really hurts. And the doctor says, well, yeah, of course your knee hurts. You're 72 years old. That's not taking somebody's pain seriously. That's saying that their knee hurts just because of their age, where their knee could have been completely fine. Their other knee might be completely fine and just as old. So it's something that we need to be conscious of when we're interacting with older adults, and something that we need to be conscious of when we're providing services.
Yeah, you mentioned that this is like other isms, like I think about sexism or racism. How does ageism interact with those other isms?
Yeah, so that interaction is called intersectionality. And there's, like all the other isms, ageism interacts with everything else in your life. So let's take feminism, for instance, and sexism. Ageism really plays off of that. If a woman who is in her 70s today, she grew up in a time in which it was not, pay for women was not that great. Upward mobility in culture for women in business culture was not that great. And so that all led to a net worth that is less than men towards retirement. On top of that, you add in that women are expected to leave their jobs when they have children. Oftentimes they're expected to be caregivers for their older relatives. 60% or more of caregivers are female. And so that also is a step back in income, and it's also a step back in benefits. You're not paying into Social Security and Medicare as you do that. So if you take all of that and look at the net worth of somebody when they retire, women are oftentimes going to have a lower net worth than men. And that's why we see 60 to 80% of our services at PCOA go to women. On top of that, we have racism. So people of color, we know, suffer disproportionately. Marginalized communities suffer disproportionately. And so somebody of color might not trust going to the doctor, might not have as high of health literacy. And so that affects them when they become older and need to go to the doctor for certain things.
Yeah, I know we talked about that on a prior show of PCOA Voices about racism and how to be a good ally. And I'm guessing for ageism, like with any other ism, there are things that all of us could do to be more aware of or to be more inclusive in the way that we talk and act. Can you give me a couple of examples of things that we could each do?
Sure. I think the first thing that everybody can do is just start saying older adult or older person rather than saying senior or elderly. Studies have shown that senior and elderly actually bring up negative emotions about aging and kind of keep those ageist tendencies. So switching that vocabulary is very simple and something we all can do. Another thing that we all can do is just make sure we're not comparing generations based on age. So let's say an older adult tells a kid that they're not learning cursive in school, so they must be, not that well educated. Well, that's not true. Times have changed. And kids shouldn't be telling older adults, well, you automatically don't know how to use technology because you're in your 60s. That's also not true. Many older adults know how to use technology, oftentimes better than I do. So I think that we need to make sure that we're treating everybody based on their merit, not on their age.
Yeah, I'm really glad you brought up the issue of intergenerational issues. I've always been curious, I have to ask. Generationally, you're a 20-something millennial, Maddie. What is it like for you as a young professional working in the field of aging?
Yeah, that's a great question. I love working in the field of aging. I love everything that I'm doing at PCOA. But it's certainly challenging. You mentioned I'm 26. I started my career when I was 17. I have 2 degrees in history and political science, and I was 2 sons' youngest, 40 under 40. So I'm a young professional. And one of the most challenging things is to be taken seriously. I remember my first few weeks on the job here at PCOA, I was meeting with some community members, and they said, well, how can you advocate on behalf of older adults? You obviously have no idea what it's like to be old. And that's true. I'm not old. But one of the issues is that I am completely qualified to do that work, and I'm able to do it, and I've been very successful in doing it. And so they were judging me based on my age and not on my merit or ability to do something. And I think that that's common for a lot of younger people, not just in the field of aging. I worked outside of the field of aging before, and I think it's common with just a lot of young professionals to be taken seriously.
Thank you for sharing that. And thank you for taking the time to join us and give us your perspective and tips. We're really lucky to have you representing us both locally, statewide, and nationally, Maddie.
Thank you. Thanks for having me.
Yeah. So next up, I have a new face to share with you for a caregiving tip of the week. Please join me in welcoming Debbie.
Hello and welcome to Caregiver Tips. We don't expect to have emergencies in our lives, but they do happen. And so I want to share with you something that may be useful to plan ahead. If you have an emergency situation, it's useful to have a caregiver bag ready to go, kind of a grab and go bag. One of the things that you might want to consider is, if I have an emergency, who am I going to call to take care of my loved one in the event I need to go to a hospital or have an urgent situation? It might be a family member, a friend, a church member, or maybe even a neighbor. But someone needs to know where the bag is, the grab and go bag, and what they need for your loved one. So my recommendation is that you develop a list. Let me give you some examples of things you might want to consider including. Provide the names and phone numbers for all the doctors and along with the medical conditions. Another thing that can be useful is a list of or copies of legal and medical paperwork that might be relevant, such as in Arizona, there's an orange sheet for who have chosen to have a do not resuscitate order. Maybe they have a living will. A power of attorney can be useful along with insurance card or maybe driver's license as well for identification. Also, keep a list of the medications and where they're located. And it's useful to have the medication instructions so that they'll know what to do with them once they have them. Some people are using CPAP machines for breathing. So is that something that's going to need to be on your list? What about foods? Does the person have any allergies to foods? Do they have favorite foods, or maybe they have a special diet that needs to be considered? And what about habits of the person that you're caring for? We all have habits in our lives. And some of them can be more important to our routine than others. So do you need to list those for the person that's caring for your loved one? Do you have any animals? And who's going to care for them if you have a medical emergency? Another thing to look at is, what are the assistive devices that they need, such as glasses, hearing aids, walkers, maybe incontinence supplies. So list those that you can think of that might be useful as well. And then the last thing that I want to get you started with are, what are the personal items that might be useful to have in your grab and go bag? Does your loved one need a special type of pillow? What about a favorite blanket or pictures of loved ones or their wallet or purse? That's the caregiver tip for the day. So thanks for joining us. Until next time.
Well, thank you, Debbie. You're such a knowledgeable, patient, and caring resource for family caregivers, and I hope we'll see you back again. If you need help or have questions about services we offer as an area agency on aging, give our helpline staff a call, 790-7262. You can also send us suggestions for topics you'd love us to cover in future episodes of Voices at voices@pcoa.org. We'd love to hear from you. That's it for today. Take care out there. I'll see you again with a new episode in just a couple of weeks. And until then, be safe and let your voice be heard. Bye, everybody.